We now welcome patient advocate Tammy Garrett to share her important story regarding FCR, fludarabine, cyclophosphamide, and rituximab, a potent chemoimmunotherapy combination, and how it affected her CLL journey.
Thank you to the CLL Society for asking me to be part of this Ed Forum and share my story with you today. I was diagnosed with CLL on June 4th, 2014. I went to see my family doctor because I had a lump at the top of my right shoulder. At first, he said it was nothing. However, as he was walking out of his office, he said he would send me for blood work. I left his office thinking I had just wasted both of our times and didn't think much more about it. The next morning, he called me and seemed as shocked as I was when he said, "You have leukemia." I went to his office right away and he said I had CLL, the good kind of leukemia. He said it was more common in men in their 70s and that it was possible that I would never need treatment. He said he was sending me to see an oncologist, and since it was not urgent, that I shouldn't worry about it. At the same time, he also told me that I should get my affairs in order, so needless to say, it was all very confusing. I made the huge mistake of looking up CLL on Google. Thankfully, a family member quickly advised me not to do that and offered to research and find the best and most accurate information available. I'm grateful every single day that they did that for me. I am not sure I would be here today to talk about how I became a smart patient, encouraging others to do the same if they had not done so. Like most CLL patients, I was originally placed on watch and wait, but my cancer was aggressive and I progressed quickly. I went for monthly blood work, and as my white blood cell count was increasing and then doubling, I was told I was getting closer to treatment. When I was first diagnosed, my white blood cell count was at 24, and the day that I was told I had to start chemotherapy, I was at 350. The only option I was ever given was FCR, chemotherapy. The family member who was helping me with the research suggested I should ask about being tested for 17p deletion. They had read that patients who are 17p deleted have poor clinical outcome and don't do well on chemotherapy. I asked my oncologist about 17p deletion on a few occasions, and if it was possible to have a FISH test. I was told that they don't do genetic testing until a patient relapses after they have completed their first line of treatment, meaning FCR. Knowing what I know now, that statement is hard to fathom. Looking back, I remember thinking, there's no way I can be 17p deleted. Surely my chromosomes are fine, because my oncologist is not concerned and doesn't even want to talk about it. I eventually stopped asking him because at the time I was not aware how truly important genetic testing prior to treatment is. This is one of the main reasons why seeing a CLL specialist is so important. When I started chemotherapy 17 months after my diagnosis, there was still no discussion on targeted therapies or what would happen if I relapsed. My oncologist said we would worry about that if it happened. I didn't think I had any other choice but to trust and keep going with what I was being told had to happen. The chemotherapy was very difficult, and I was hospitalized a few times with neutropenia, as I had very low levels of neutrophils. I lost a lot of weight and never felt like anything was improving, therefore not going into remission. Shortly after my fifth treatment is when I finally went for a second opinion and underwent extensive genetic testing. Unfortunately for me, the results of the tests were not available until after my sixth and final chemotherapy, which made me very sick and I ended up in the hospital for an extended stay. Looking back, I never should have done my sixth treatment, let alone chemotherapy at all. But I was scared not to and trusted that it would be okay. I ended up switching oncologists and found a CLL specialist after receiving my FISH, IGVH mutation, and TP53 mutation results. I found out that I was 17p deleted, had complex karyotype, and was unmutated. If I had known this information beforehand, I would not have undergone FCR therapy. Luckily, I was quickly enrolled in a clinical trial and was on acalabrutinib monotherapy for a little over 3 years until I started to resist it. I am currently managing my disease with another monotherapy, ibrutinib, and already know what the next treatment will be when I start to resist this one. My CLL specialist watches my genetics carefully and is always willing to discuss my options early before they are needed. I am humbled to share my story and help anyone who is going through their own cancer journey. I've made it my mission to raise awareness of the importance of advocating for yourself and making sure you have all the information and tests needed before starting treatment. In doing so, I have met a couple of CLL patients who were about to start chemotherapy, and after hearing my story, they asked and insisted that they be tested. I know that one of the oncologists did not want to test, but the patient continued to insist until their oncologist finally agreed to do a FISH test. As it turns out, she is 13q deleted, and because she advocated for herself, she was able to bypass chemotherapy and did well on monotherapy. She is currently in remission and has made sure to discuss what her next treatment would be if needed with her oncologist. The fact that sharing my story helped her in not having to go through chemotherapy that would have made her very sick makes my journey well worth it. I can't say enough about advocating for yourself, finding a specialist, and making sure you keep up to date with the most accurate information like what is provided by the CLL Society. I am personally very grateful for all the help I've received from the CLL Society during my journey. Test before treat is not just a saying, it can literally save your life.